All right. Well, good morning, Dr. Janita Morrison and everyone. First of all, I would like to welcome you to the update on COVID-19 with Dr. Morrison. Before we turn this to Dr. Morrison, I would like to ask each one of us to introduce ourselves with name, pronouns, title, and organization. I am going to start first. My name is Thia San. My pronoun is she, her. I'm a coordinator, community health educator with Pacific Asian Counseling Services, and I am your facilitator this morning. Next, I would like to popcorn to Angela Nguyen.
Hi, good morning, everyone. My name is Angela. My pronouns is she, hers. I'm a community health worker from the Asian Youth Center. I'm going to pass it on to Richard.
Good morning. My name is Richard San. My pronoun is he, him, and his. I am a prevention and early interventions outreach coordinator. I'm working with the Pacific Asian Counseling Services. And I would like to popcorn it to Carrie.
Good morning, everyone. My name is Kerry Chai. I'm with Pacific Asian Counseling Services, he, him, his. I work as the community health worker, and I popcorn to Violetta. Thank you.
Violetta? Okay, I'm going to go with Joshua.
Hi everyone, my name is Joshua, pronouns he, him, his, and I'm a community health worker with the Asian Youth Center.
Okay, thank you, Joshua. It looked like Violetta having a problem with her microphone, so we'll come back. But anyway, well, now I would like to have Dr. Morrison introduce herself and also update us on the COVID-19.
Everybody, my name is Janina Morrison. My pronouns are she, her. I am a physician working for the LA County Department of Public Health. I am trained as a primary care internal medicine doctor and also in a specialty called preventive medicine, which is a public health specialty. I've been with the county for 9.5 years. I started off as the medical director for the Wellness Center, which is a collaborative community center at LA General Hospital in Boyle Heights. And we had mental health services, cooking classes, exercise classes, services for families, healthcare enrollment. And I also was a primary care provider in the clinics there. And then during the pandemic, I moved over to the other side of the public health department where we do disease control. And I work on the mobile vaccine and testing team. So we have a wonderful, really big team of about 150 people that coordinate vaccine and testing pop-ups related to public health all throughout the county. And I've had a bunch of different roles on the pandemic. One of my favorite things is to work with community members who are having these everyday conversations about the vaccine, trying to get out the truth, what we know from science, and have these tough conversations and just move people gently towards, making the decision that's right for them so we can get as many people vaccinated as possible. And we started with the COVID-19 vaccines, but now we also always offer the flu vaccine with the COVID-19 vaccines. We don't yet have the RSV vaccines, but we talk to people about them because they are available in pharmacies and some doctors' offices. And they're a great idea for older people. And we do a lot of other work on the side. We work on hepatitis, we work on STIs, we work on TB. So we've basically learned so much from organizations like yours that we have added in things that we can continue to bring to the community. So, can I ask, like, geographically, are you guys, am I right here, like, kind of down by Long Beach? Are you all spread out, or what part of the county? Oh, you're on mute, Cynthia.
Well, we is basically for LA County, but I think we have Asian Youth Center and Park. We are partner. We pretty much close to Long Beach,
Okay.
with Bellflower, Lakewood, Downey,
Okay.
and I believe Angela, from your side, from your agency, which city that you really work with?
We're with the San Gabriel Valley.
Okay. Oh, great.
Mhm.
Okay. So you really are in a bunch of different parts of the county.
Yeah, that's correct. Mhm.
So I think Los Angeles County is the coolest, most complicated, challenging place to work. Never a dull moment. So many different kinds of people, so many different kinds of neighborhoods. And so it's a really fun place, though it can be a really challenging place to get the word out, to get people to vaccines, and this year is no exception. So in terms of talking about COVID, so I think, did you guys send me like a whole list of questions?
Yes, we did, Dr. Morrison. We sent you some question, but I think before question, we just also want you to update us what's going on, with the COVID-19. We want to know what is the new symptom, side effect, efficacy, qualification requirement for the new vaccine. That pretty much that we want you to update first, and then we ask a question.
Okay, sure. Yeah, it was a great list of questions. So I definitely want to leave time for that. I was nervous about showing you guys slides because I think many of you have seen my slides. And so let me just give an overview. So in terms of COVID cases right now, where are we? It's almost the end of October. Everybody agree?
Yes.
What happened? Okay, it's almost Halloween. And that's amazing. So we are coming up on winter. Right now, there are less COVID cases than we had about a month ago. So we had a bump up, kind of back to school bump up, and we did see more people testing positive, and we did see more people in the hospital, and we did see more people dying. But it wasn't a very big jump up. And we weren't too surprised. We usually see that at the end of the summer and the back to school. And our takeaway was very similar when we looked at who was getting really sick. It was people who were older, people who had lots of medical problems, and people who were not up to date with their vaccine. So most of the people we saw in the hospital and passing away had never gotten the bivalent. So as of August, what you needed to be up to date was the bivalent. And some people got it last year in September. It was still keeping those people safe, which is great. Now, older people, they had the option, they could get it in September and then they could get another one in March. We don't have enough information yet to say, like, how much did that March vaccine help? But we do know that the people who got the bivalent at least once, they were much safer, about 3 times less likely to end up dying from COVID. So every time we see this bump up, we get more confidence that this vaccine is really important. And same thing, every time we see people getting the vaccine, we look, any new side effects, anything scary that makes us think, oh, older people shouldn't get it, or you shouldn't get it on the same day as the flu. Nope, we haven't seen anything like that. So it's now been hundreds of millions of people have been getting these Pfizer and Moderna vaccines, and we feel great. They are super safe, and they protect us. So we're coming up on the end of October. What we expect is maybe a couple more weeks where the COVID numbers are low. And then when we hit Thanksgiving, they're going to start going up again. We're going to have traveling. We're going to have parties. We're going to have colder weather, drier weather. Well, actually, we might not have drier weather. We have the weirdest weather here, right? Like maybe it's going to start raining, but we're going to be inside more. And that's when we see more COVID. So usually by Thanksgiving, we see the numbers start going up. Now, sometimes, like I think it was 2 years ago, right before Thanksgiving, we saw a new variant. That was Omicron. And so we never really know. Right now, we haven't seen a new variant in another part of the world that we're worried about. Right now, we're just seeing the same variants. They're changing a little bit. They're all kind of related to Omicron. So, but either way, no matter what we see this winter, the new updated vaccines are the best tool we have to keep us from getting sick, and especially for older people. So we have these updated 2023-2024 vaccines. They came out in September. There's a Pfizer and a Moderna. Those ones are available right now, though I'll talk a little bit more about where to find them because it's not super easy. But they've been approved, they've been studied, they work, they're safe, they don't have any kind of different side effects. In fact, what I tell people who are afraid of like the achiness and the fever is like, don't be worried that it's going to be as bad as the first time you got the vaccine. A lot of people got a lot of symptoms the first couple shots we got because we'd never had COVID. And we got those first 2 shots really close together. And that's what we needed because we needed like this super high level of protection back then. But it did make people kind of annoyed because they maybe had to take a day off work or they really felt bad for one day after the vaccine. So there are people out there who say, I got too sick after the vaccine. I'm not getting it again. So the one that we have now, the side effects are milder, much less likely to, I don't know, anyone, maybe 1 in 20 would get a fever. Most people, it's just a sore arm, a little bit tired. So the side effects are not as bad and the vaccines work really well and they're a good match to what's causing the COVID cases right now. So we have the Pfizer and the Moderna that are available. It's just 1 shot and everybody who's over 6 months needs it. So it doesn't matter if you had 1 booster or 2 boosters, we're not counting anymore. It doesn't matter if you had the bivalent. This one is new. The bivalent was designed to match last year's COVID, and this one is designed to match this year's COVID. So we all want to get it so we have the best match. So we don't have a vaccine available for little babies under the age of 6 months, but everyone else, there's a vaccine. So if you're a little kid, 6 months to 5 or 6 months to 4, there's a little kid version. Then if you're 5 to 11, there's a big kid version. And then the rest of us get the 12 and up version. And it's just 1 shot. I recommend getting it on the same day as the flu shot, just because then you only have to do 1 visit and you don't have to worry about it. You can get them in the same arm. And then you're protected and you have that layer of protection for the winter. And now is the time to get it. We are not that far from Thanksgiving. So we want people to get it now. It takes about 2 weeks for our immune systems to really learn what the vaccine wants them to. So then you get it and 2 weeks later, you are fully protected. And we think that protection usually lasts several months. So protect you for Thanksgiving, for the end of the year, for the new year, for January. And then by the time February comes, we would expect the numbers to be coming down. And a lot of us, the vaccine actually works for, you know, a year. So even those of us who get it now will still have some protection over the summer. So, when I talk about, you know, who needs the vaccine, it's recommended for almost everybody except little babies. But the people that I really am worried about are older people and people with medical problems. So if I'm having a conversation with a group of people and everyone's sort of saying, I don't know, those are the people I'm going to pull aside and say, okay, let's actually talk about this, because, you know, it's not super, super common, but this, you know, COVID can kill somebody who is over the age of 65. And even if they don't have health problems, they can just get COVID, they get pneumonia, they end up in the hospital, and they pass away. And it is, you know, it is so amazing that we have a vaccine that can prevent that. And so it's worth the time trying to, you know, get to the bottom of like, what is standing between you and getting this vaccine, because you never know, like it's your dad or your mom or your neighbor who's going to be the 1 in 1,000 who gets COVID and gets so sick that they die. That vaccine is gonna protect them. So it's not everybody's favorite conversation these days, because people are sick of talking about COVID and sick of talking about vaccines. But vaccines are amazing. They really are, you know. And sometimes when you're talking to older people, I don't actually know if this works. You can tell me if this works, but it seems to make sense in my head. Like, I take care of all kinds of people who have diabetes, high blood pressure, high cholesterol. It is so hard to take care of those things. You have to take pills every day. Diabetes is a pain. You got to think about what you're eating. You got to think about when you're eating it. And it's so much work. And, you know, a lot of people have to do it. They think about those diseases and they have to put the time in. This is so much easier. It's so much easier. If you want to say, you know, okay, what can I do to keep myself safe from medical problems right now, from COVID? Just one shot and you're done. You're done. You don't even have to think about it. You did it. You put in the time. You know, it's not nothing. You got to find where to get the vaccine. You got to go there. Maybe you have to deal with a day of sore arm or feeling a little tired. It's not nothing, but it's so much easier than the other things that we do, you know, for staying healthy. So, I just really want people to try to, you know, try to recognize that and just say, okay, well, this, you know, and you really should feel good. You know, I got mine, gosh, I don't know if it's like a month ago, because it, you know, it came out a month ago. And, you know, every couple of days, I'm like, good for me. I did it. You know, I hear about somebody getting COVID. I was actually on a plane last weekend with a group of people, and one of the people tested positive. She sat right behind me on the plane, and for a second I thought, oh no. And then I said, you know what, I did everything right though. I did everything right. I got my vaccine. I don't have to feel stressed about sitting next to that person who had COVID, because I did my job. I got my vaccine before I got exposed. And I got my dad vaccinated, who was also sitting next to me on the plane, who's almost 80. So it actually feels good. Once you get out there and get it, you can think, you know, oh, I'm protected. I can worry much less. And I really do want people to worry less. If you are up to date with your vaccine, then you know, you should enjoy your life pretty much like COVID doesn't exist, because that's how good these vaccines are. Okay, so then the last thing I'll talk about before we do the questions is, what's the reality about where to get the vaccine? So it's a little complicated. You can't necessarily go to the same place you've been going to get all the other vaccines because the pandemic part of the vaccine is over. So we don't have free vaccine in all the different locations, which I find to be a little heartbreaking, but I'm also used to working in the American medical system, which is always a little heartbreaking. Like we don't have the best medical system. It is pretty complicated and hard to navigate. So we kind of just have to go back to that mode of like, okay, everyone's going to need a little extra help finding this vaccine. So now for a lot of people, if you have medical insurance, the biggest challenge has been that the vaccine didn't get delivered super fast. So it was going places like CVS and Walgreens and Rite Aid and some doctors' offices who ordered it, but it didn't really come right away. So people may have heard, oh, it's available, and then they went to try to get an appointment. And at least my dad had this experience. His COVID appointment got canceled 3 times. And he's calling me like, what the heck? I'm like, ooh, I don't know. Like CVS, that's the biggest vaccine provider in the country. And even they were having trouble getting the vaccine started, getting the shipments started. There's more than enough vaccine. We're not going to run out. But it was bumpy in the beginning. So you may talk to people who are like, oh, I don't know where to find it. I called CVS. So those people, we need to just tell them to keep trying. Things have gotten much better. Like when it first came out, we only had a couple thousands of doses in LA County and, you know, tens of thousands of people wanted it. Now we have hundreds of thousands of doses. And the big pharmacies are usually the best place to go. So if you have insurance, you go to CVS, Walgreens, Rite Aid, Bonds, Albertsons. That's the easiest place to go. Now, if you don't have insurance, you can still go to CVS and Walgreens. CVS and Walgreens are part of a special program where they got doses. They have to give them to people who don't have insurance. Now, sometimes I think the people at CVS have gotten confused because it's a new system. So you may be, especially if you're working with people who are undocumented and don't have medical insurance, they may need just like a little help to say, nope, CVS has to give you this dose and you should not be paying at all. CVS and Walgreens. And if they have trouble, you circle back with CVS and Walgreens, and then you let us know at the Department of Health. You know, you can email, you know, whoever is your main contact, let them know. They'll send it to us, and we will start calling them and saying, what are you doing? We know you have these doses. So CVS and Walgreens, still a really good option. One tricky group is Kaiser patients. So Kaiser really likes to do their own vaccines. So I do know Kaiser patients who have been struggling to get an appointment at Kaiser. I think, and you know, Kaiser was on strike, and so it was like a lot of things were going on. The best place to start is Kaiser. If you are calling Kaiser and they don't have an appointment for several weeks, especially for older people, then we want you to come to the Department of Public Health sites because we don't want people to wait. And we are working with Kaiser to say, hey, you can't make people over the age of 65 wait till the end of November. Like, no, that's not safe. But it's in the process. The good news is if you come to a Department of Public Health site, then we don't turn anyone away. So even if you have Kaiser, they're probably not going to pay us back. We're just going to vaccinate you anyway. Another group that's been challenging is kids. So a lot of parents, their preference would be to go to their pediatrician there are not very many pediatricians who ordered this vaccine, unfortunately. So most of the pediatricians' offices don't have it. If your kid is 3 and up, they can go to a pharmacy. And again, that's going to be the easiest place to go. Go to CVS, go to Walgreens. For little kids, it's really tricky. We recommend coming to the Department of Public Health sites. And the Department of Public Health sites, I can show you if you want how to find them. There's 2 pods that are open that can see lots of people. And they're open Wednesday, Thursday, Friday, Saturday, Sunday, and they're open early. No, they're not open early. They open at 11 a.m., but they're open until 7 p.m. So people can go after work. I think the closest one to Long Beach area is at Ted Watkins Park, which is in South LA. It's not super close, unfortunately, but it's quite easy. Like, it's a big park, it's got parking, you just go, you don't have to make an appointment, you walk in, you can bring your kids, you can bring little kids, they have a lot of experience, and you can get your vaccines and you're done. And then there are public health clinics as well that have different locations. And do you want me to show you? Would that be helpful? Can I share my screen?
Yes, yes. Dr. Morrison, you can share.
Okay, let's try this. Can you see my browser?
Yes.
Yes, we can see your browser. Yes.
Okay, I'm gonna do this like this is actually how I do this. I go to Google and then I go LA DPH vaccine clinics. And then you get to this vaccination sites, LA County Department of Public Health. And then you get this pretty website. So the reason I didn't give you a website is because it's not, I find this one to be not very helpful. It's like, you know, /media /something /blah, blah, blah. So I always start from Google, LA DPH vaccine clinics. So there's a couple different resources on here. So here are the pods. So you can see Ted Watkins Memorial Park, Wednesday through Sunday, 11 a.m. through 6 p.m. No appointment needed. They also do flu vaccines for everyone. And then Obregon is in the kind of East LA area. So I think that's farther away, but I'm kind of terrible at LA geography. So you look at a map, you can figure it out. Same thing, Wednesday through Sunday, 11 a.m. to 6 p.m. So this is a great option for Kaiser patients who are haven't gotten an appointment soon enough, and little kids, and anyone else. And then another option. So here, public health centers, there's a link right here to all the public health clinics. So you get a PDF. Which hopefully will show. And then you can see all the options. So you guys don't probably want to go to Antelope Valley. Maybe you know people in San Fernando Valley. So this is just a Friday morning option. So they do have walk-in appointments. But if you call, they will give you an appointment and then you're guaranteed to be seen. There's not a lot of people coming though. So if people want to go, like they look it up and they're like, oh, they're open today. They call on the way and just go. Here, San Gabriel Valley, we have Monrovia and Pomona. And then we have some in LA. We have downtown, we have Hollywood, then we have South LA, MLK, and another one in Whittier. So, you know, this is not the easiest thing to navigate. It's not easy, but if you all can take the time to look at this, it's up to you. You know, you want to bookmark it or you want to print it so that when you're talking to people in your community, you have this as a resource and you can say, and it makes a difference. You know, if someone says, okay, I'll get vaccinated. Well, let's say, okay, let's decide, let's pick a time when you're going to go. I want to make sure that, you know, you get to the next step. Then let me just show you if there's anything else on here. I think this is the best. I think that's the best. We do have mobile pop-ups. So you know, we can work with you to host one of those. It's not all that easy to search those and find them. The systems that helped us find things in the past are just not, they're not working in the same way. Oh, sorry. This is the last thing I wanted to show. So you can still call the DPH vaccine call center and they will help you find a place to get vaccinated. And the other thing they can do on this is they can refer you if someone can't leave their house, if it's hard, like if transportation is an issue or if they're older and mobility is an issue, call this number. We will send a nurse to your house to give you the vaccine, and everyone in the household can get vaccinated at the same time. And we bring COVID and we bring flu. So those are some helpful resources. Okay, so let me pause there. Do you guys want to start by putting questions in the chat or raising your hands? How do you want to do it?
Well, thank you, Dr. Morrison. There's a lot of information that you're sharing with us. So now we open question and answer, and I would like to have Richard to help monitor in chat. But if you have a question, please raising your hand. So we try not to speak overlapping because Dr. Morrison, we're going to translate this video recording.
Okay.
Zoom meeting, the Zoom video recording to several languages, so then we will subtitle it in particular language. So now, anyone would like to ask Dr. Morrison a question? Please raise your hands. Okay, Angela.
So my question is, I kind of forgot, but let's just say if someone got sick with COVID and I forgot, how long do you have to wait before you can get the vaccine?
Great question. Yeah, because we actually do know a lot of people who got COVID not long ago, right? So there's kind of two different answers. One is like, what is the rule about how long you have to wait? And that is, the answer to that is not very long. We don't want people who are actually sick with COVID going to get the vaccine because they should stay home. We want them to not give it to anyone else. Not because it's dangerous. It's just, you know, we don't want you to, it's not that the vaccine is dangerous. It's just that when you're sick with COVID, you should stay home. That's the basic rule. If someone has just had COVID and they really want to get the vaccine, they're not contagious anymore, and they're like, you know, this is the best time of the year and I'm never going to remember if I don't get it now, get it now. Like, say, for example, this might actually happen. You have a family, you're talking to a family and there's like grandma and grandpa and mom and kids, and they're like, okay, we understand everyone should get the vaccine. Let's all get it together. We're all going to go to Ted Watkins Park on Sunday and get the vaccine. And then one of them had COVID like 3 weeks ago. So that person, just get the vaccine now. Just get it now, because your whole family's going. It's, you're going to make a day of it. If you don't get it now, you're probably going to forget. So I think that's a person where we say it's totally safe to get the vaccine if you had COVID recently. We just don't want you to go out when you're actually contagious with COVID. Now, the other answer to the question is, well, people say, well, wait a second, I just had COVID. Do I need the vaccine right now? So again, the first thing is it's totally safe. If you get the vaccine right now, it's going to give you a great level of protection for the winter, which is when you really need it. You can wait because your body will give you a little bit of protection for a little while. So, I think I have construction starting behind me. 1 second, let me close my window. Excited I made it 38 minutes with an open window. So if you are going by yourself and you're not worried about forgetting and you want to just wait, until you have your immune system has dipped down after a case of COVID, then we say you can wait 2 to 3 months. So when you get COVID, you have 2 to 3 months of a really high level of protection, and then you should get the vaccine. For people who are older, I say just wait 2 months. For people who are younger, they probably have 3 months, so they can wait 2 to 3 months. But the key here is just don't forget. You can't forget. You got to get that vaccine. So if you think you're going to forget, just get it now while you're thinking about it. And because, the holiday season gets really busy and you maybe, think, say I just had COVID and I'm like, okay, I'm going to wait 3 months. Okay, I should get it, December 26th. I'm not going to get it December 26th. Like, that's not a good day. I'm going to be busy cleaning my pots and pans and, tripping over my children's new toys and stuff like that. So I'm going to say, I'm not going to wait till December 26th. I'm just going to get it December 1st when I remember. It's a good date. Or I'll just get it now because my kids are getting it now and I'll get it all at the same time. Is that helpful, Angela?
I think, yeah,
Thank you.
yeah. Any other question? Well, I know that Dr. Morrison, when you updated, you covered a lot, most of the question that we were planning to ask you. Maybe Dr. Morrison, maybe you can talk a little bit about Paxlovid. When you have a COVID-19, how do you know that you should take Paxlovid or not? Because I heard there's a lot of side effect on Paxlovid. Some people cannot take it. They have to stop, like take only first pill or 2 pills and they have to stop because the side effects are just so bad. So please share with us about that.
Yeah, so what we know about Paxlovid is that it's really good at keeping older people out of the hospital. So at this point, I know a lot of younger people who are super scared of COVID and they take it. It's not dangerous. It's just annoying. The side effects are annoying. There's a kind of terrible taste you get in your mouth. I've heard of people getting nauseous, but it's not dangerous. It's not like it causes terrible things to happen. It's just, you don't feel great. And you didn't feel great to start with because you had COVID. So it's like, it's a lot of people like, they just think, ugh, why would I do this? For people who are young, it's kind of a personal choice. Like, some people will say, I'm okay with the side effects. I'm so scared of getting severe COVID. I'm so scared of getting long COVID. I will do whatever I can. And so in that case, you just talk to your doctor, or you can call that same phone number from the health department because we have our own Paxlovid program. And the thing with Paxlovid is if you're going to take it, you got to take it pretty quickly. So if once you get that positive test, you basically have like a day to figure out if you're going to take the Paxlovid and get the Paxlovid. So I know a lot of people who are kind of on the fence and they're having trouble getting in touch with their doctor, and then they just don't end up getting it. So I don't want that to be the barrier. If you're having trouble getting in touch with your doctor, call the public health department. We have a telehealth program, so you don't have to come in. We have a language line, so they will connect with, you know, all the different interpreters you would need. And they will get you the Paxlovid. They just send a message to whichever pharmacy you want to use, and they get you the prescription. And if you don't have insurance, then we have different places you can pick it up for free, or we can send it in the mail. So, but for older people, people over the age of 65, or anyone like who's had a kidney transplant or who has cancer, that's the person we're going to say, I'm sorry, this is annoying. It's just worth it. It's just worth it. You want to get Paxlovid, you want to get it as quickly as you can, and just get through the side effects, because it works. It keeps people out of the hospital. So I think there's a lot of people who are going to be on the fence. I will tell you, like, my mother has taken Paxlovid twice. Both times she was like, blech. You know, this is gross. But then she has the knowledge of, like, I am doing whatever I can to prevent severe COVID because she's older. But for younger people, I don't spend too much time talking about it. I do know that younger people are like, oh, I need to get it. And that's fine. It's not dangerous. But we don't have a lot of evidence that it's necessary, that it's really going to make a difference, especially for people who are vaccinated.
Thank you, Dr. Morrison. Anybody else have a question before we wrap up?
Yes, I have a quick question. Dr. Morrison, do you mind if you can elaborate a little bit about COVID-19 rebound?
Yeah, that's another annoying twist that COVID has thrown at us. We don't entirely understand it. So when you hear about it, usually it's because someone has taken Paxlovid. Because what happens is they test positive, they take Paxlovid, they feel better. Sometimes they even test negative, and then their symptoms come back and they might even test positive again. And it's like, ugh, like, what the heck? I thought I was done with this. And so I think that some people are concerned that that's like Paxlovid's fault, that that's something that Paxlovid did to, like, you know, make your COVID longer. I don't think we understand it very well. And my experience, especially in the beginning of the pandemic, is that there were actually a lot of people who got COVID, had symptoms, got better, and then had a little bit of a second hump where it may be that's the immune system response. You know, one of the things that COVID does that made it so deadly in the beginning was it really revved up our immune systems. So, you know, half of the pain whenever we get a virus is just our immune system going gangbusters, and you get like super congested and really fatigued. And it's just your immune system going, we're not taking any chances. We're just going to like rev up like all these different chemicals that kill COVID, but also make you feel crappy. Excuse my language. So with COVID, because it was a brand new virus, we would see that initial immune response sort of maybe even kill all of the virus. And then the immune system sort of keeps going. And you're like, oh, why don't I feel better? And when you put Paxlovid in there, it seems like that, you know, we're just more aware of that because the Paxlovid makes the first phase shorter, and then it's even more weird that you're like, oh no, I was really better and now I'm feeling worse. But it's not really Paxlovid's fault. So for older people, you know, you may see a little bit of a rebound. It's still a really good idea to take Paxlovid, because what we don't want is that first phase to go like, rah, like so bad that you need to be in the hospital. The second phase, the rebound, where you have symptoms after you felt better, it's not dangerous. It's not like people are getting so sick then that they need to be in the hospital. They're just kind of like, hey, I thought I felt better and now I feel a little sick again. But it's like it's a little sick. It's not very sick. So you may have like a different experience of COVID with Paxlovid versus not Paxlovid. If you're young, you may have like more say I don't take Paxlovid. My symptoms might be right here for like 5 days and then I'll get better. Whereas if I took Paxlovid, my symptoms would go down and then go up. It's like, I don't know. It's like, how do you even know which one of those you want to choose? They're not that different. And then you have to deal with the side effects from Paxlovid too. But with older people, it's still really clear cut. It's like with Paxlovid, you may have a down and then a little bit of an up, but without Paxlovid, you may have like, and you end up in the hospital. So we still say, just go for it with Paxlovid. But I really do think that rebound is happening to almost all of us. It's just a little more obvious for the people who took Paxlovid. It's just part of what COVID does.
All right. I think it's time for us to wrap up. And would thank you so much, Dr. Morrison, for updating us on the COVID-19. We appreciate you for spending your busy schedule with us, and we have learned a lot of new information on COVID-19. Asian Youth Center and Pacific Asian Counseling Services will have this session translated to I think Chinese, I think Khmer language, and Tagalog and Vietnamese. That's so far, and we'll share this with our community with the social media. Well, once again, thank you everyone for your presence, and have a great Monday. Thank you, Dr.
so
Morrison.
much.
Bye-bye.
Thank you so much.
See all of you. Thank you.
Thank
Thanks for
you.
everything.
Thank you.